So, welcome to Occult Awareness, the podcast that shines a light on the shadows of the unseen in our healthcare journeys. And I'm Amy, and each week we explore the twisting path and diagnosis, challenges that faced by those conditions that don't show up easily on a standard checkup. From EDS to CCI and beyond, we are here to share real stories and bring the insights of health professionals navigating the intricacies of occult conditions. In today's episode, we will hear from Dr. Hilary Merry, who will share her personal battle with her conditions with EDS and the multiple comorbidities. Thank you so much for agreeing on this interview, and I'm really excited to explore your journey and also just everything around the healthcare systems and how to navigate it.
Yeah, very excited to be on here. As you've pointed out, our stories aren't the ones that people like to hear most of the time, or that they are used to hearing. So my journey with EDS, I guess, and all these comorbidities has two start dates, and it's always difficult because that's what the doctors usually ask us to when come in for a visit, is kind of like, when did this all start? So the one answer is like at birth, right? Because it's a genetic condition. And then the second is, for me, I don't have any memories of not having symptoms, like losing vision when I stand up, not being able to, like, not feeling like I could breathe well, not being able to tolerate heat, showers, leg sweat, like all these things that, like rashes, like all the things that now kind of make sense. But yeah, my journey started with just a bunch of unconnected, health issues that began when my brain switched on. They probably began before that, but yeah, I take notice when I start taking notice of, being conscious at all. So yeah.
Yeah, I definitely see that, like, because it's genetic conditions. But when did you first notice the symptoms, like with the EDS?
For me, like I noticed them as soon as I have, like, my first memories include these symptoms. Like my first memories include like asking my parents, like, why can't I see when I stand up? Asking them like, why can't I, it doesn't feel like I can get a full breath in, and then, the doctor testing me for asthma and that being negative. Um, and being them being like, you're fine, you're getting enough oxygen. You can breathe, you're breathing right now, kind of thing. I don't really have any remembered life that doesn't include being symptomatic. Yeah.
So you're saying that your breathing problem like started even like really little?
Yeah, it's one of the first things that I wouldn't shut up about, because some of these issues, like, were pretty easy for me to some were easier than others to just like ignore until, now, or like the last, so I was diagnosed with EDS at 27 years old in 2020, while I was in veterinary school. So that's like the second start date, of this. But like, obviously I was diagnosed after years and years of like many issues, and there were several that I kind of couldn't stop bringing up as a kid. And that was one of them, because it's such an uncomfortable feeling to not be able to breathe appropriately. And, as a veterinarian, I think that's shaped a lot of my, like, how serious I take conditions like, smush face dogs and things like that. But that's a whole nother that's a whole nother podcast. It's just, not being able, the feeling of not being able to breathe, whether or not that translates to like them being able to see something on a test, it makes you panic. We know this. So yeah, that's why I couldn't stop mentioning it, is because like your brain will not let you stop mentioning it. It's a very difficult signal to push to the aside, like I did for the rashes and the itch, all the littler symptoms, the pain, that became not addressed for, ever, for such a long time. It was just because it's like, well, if I'm passing out all the time and if I can't see and if I'm like having pre-syncope all the time, then, issues of like being itchy and stuff isn't as big a deal.
Yeah, well, it seems still like a long time if you already experiencing so much of symptoms like younger age, and then
Yeah.
to be diagnosed as 27.
Yeah. Yeah. It's a life marked by unfairness, uh, and the frustration of that, and then me trying to kind of like rectify unfairness that I see in the world and other places. But um my family's very active, and I think that like not being able to keep up was something that I internalized as being like a weakness about me or something. And so then I learned early to kind of hide these symptoms because it was something that led to me being othered or like excluded, not being able to participate. Um, and as a kid who grew up mixed in a predominantly white area, like I was definitely not looking for things to make me stand out.
The issues that with a lot of EDS patients is that seems like your symptom isn't really looked upon as something that is important to serious or need to
Right.
look more into it, right? So I'm actually curious, can you explore a little bit more on like exactly 2020 what happened or exactly things that you can think about that
Hmm.
might just trigger the whole entire thing to blow up again? But with a lot of EDS patients, it seems like your symptom isn't really looked upon as something that is important to serious or need to
Right.
look more into it. I'm actually curious, can you explore a little bit more on like exactly 2020 what happened or exactly things that you can think about that
Hmm.
might just trigger the whole entire thing to blow up again?
Yeah. Yeah. Um, so there's a few factors, like some of them are factors about like physically my disease getting worse. There's also the situation that I was in being in vet school, becoming, less compatible with progressive disease. And then there's the kind of outside influences that led to that, to me getting diagnosed, which was like really my friend, my best friend, one of my two best friends, both of whom have like known about having chronic illness for much longer than knew I was chronically ill. Um, One of them looked up, like she must have read about this condition or found something out about it, and suggested that it might be something that I have, because we would talk via text and FaceTime sometimes just about our issues, and a lot of the ones I was mentioning, I guess, made her look. I don't know how she come across this info. Actually, I should ask her, but um, I was having issues keeping food down. Like I was having a lot of GI problems. That's another thing that, was recurrent throughout my life. And it did start early. It was the first thing I was ever bullied about in, maybe first grade or kindergarten. So like 5 or 6 years old. Yeah, I was followed into the bathroom, by girls my age in my class and stuff, and made fun of for having these GI issues at such a young age. But that did not lead to me mentioning them more. That's why I don't say that's one of the things I wouldn't shut up about, because I very much did shut up about that quite early, because it's something we don't really talk about in general. It's kind of taboo, it's gross. And it's again, yeah, it was something that like it was never really fixed. Like no one found any reason to look into it more. And so it was just I didn't want another reason to be different and to be like not included in things or whatever.
Kind of like shows how it's not just like you trying to seek out for help, but also like in society, there is something that it just feels like um we cannot really show up as who we are, and then we
Yeah.
cannot just be vulnerable about our issues because it seems like
Right.
there's no space for that. But I'm just really curious because like a lot of times that one thing, small little thing, right, will lead
Yeah.
to sudden burst of like flare up. So that's why when you mentioned 2020 as well, another time for all the symptoms that comes up that you seek
Right.
about help and then for diagnosis. And then so that's why I was wondering like what exactly those triggers that if you remember.
So like my disease had already kind of started getting rapidly worse before like school became virtual and everything,
Mm-hmm.
in 2020, in March of 2020, things started going downhill for me in like second semester of vet school. Like, I mean, and that's kind of like, things have kind of been going downhill. And that's why I had like, a very extensive medical history with all these, separate issues. But like, I having that situation where I kept signing up for things and then not being able to follow through, and getting jobs that I physically then couldn't do, and would go to the doctor and they couldn't find a reason why. So it just seemed like I was being lazy. So I had to quit my job in the ER after only 6 months of working at the teaching hospital ER at Cornell. And then, and that was because of that. It was because of physical stuff. And I said that at the time, even though I didn't have like a disease to explain it. I had back surgery in the past and all these separate issues, but like I was just like, I can't do it. I don't know. Like, I just physically cannot keep up with the demands of this job of like carrying dogs around, doing codes and stuff like that. Like, I can't. So, there were a lot of these little things. And then the like joint pain that I was having was a big part of it. Joint pain. And then going to a rheumatologist, I think, was important. I went to someone that I knew was aware of Ehlers-Danlos because actually another person at my school had it, and I was aware that she had it, and I asked who they went to, and it was not hard. Like, it was very easy diagnosis because he just asked about my different, like, it was a rheumatologist. He asked about my history, and I had a very long history of systemic and musculoskeletal issues, and then he did the Baton scale and like just an exam of all my joints, and it was pretty easy from there.
Yeah.
Um, but yeah, like it was a combination of a lot of things.
I see. It's like finding some doctors actually diagnosed you. It's quite important. I
Yeah,
know that there are many girls that from my support group that they haven't even got diagnosed with EDS
yeah,
on the journey to do it. And then it seems like rheumatologists seem to have really good idea. Often some rheumatologists would say either it's fibromyalgia
yeah,
or yeah.
yeah. I
But
received that diagnosis and a couple others on the same day.
mm,
But um, rheumatology is a sector of internal medicine that like is kind of used to being a dumping ground for things that other people don't understand or won't take. Neurology can be kind of like that too in a lot of ways, which is I think why it's difficult for them to accommodate the increased patient load now with like, again, because they're already in charge of like sleep disorder issues and a lot of other things that kind of aren't like you wouldn't think of as like quintessentially neurology. um
mhm,
so I think that that's why it's hard for us to like get in with, because cardiologists often will say for our issues like, oh well, it's not a structural heart problem, so um it's not our
yeah.
problem. I've been told that by several cardiologists, that like, because I was diagnosed and with or told that I had POTS, vasovagal. Actually, POTS came around maybe later, but like as a kid, I was told I had like orthostatic hypotension. Um,
Mm,
and then as a teenager, or no, it was vasovagal syncope first, and then orthostatic hypotension. Because I was like, I didn't have to go to like dissections in middle school after I fainted, and like, would then have pre-syncopal episodes every time they do something close to that. Um, but that again, that was normal. I was told this is normal, like this is just a normal variation, like it's very common for young women to faint. As it continued to happen throughout my life, it became young women, right? Not kids anymore. I was just like, keep pushing the bar, like it's normal for this group too. It's just normal, like you're fine, like leave us alone is what it
yeah.
ends up feeling like.
Yeah.
So
I hear that a lot. I remember I still middle school and I told like some other people also faint like this, or like at least having those stars right
yes.
in their eyes.
Oh yeah. Oh, always. Yes, that's another one. Yeah, yeah, always had that too.
Yeah.
Yeah.
So, oh, did you say that? So you don't have a seizure like those non-epileptic or?
I've never been diagnosed with a seizure disorder or like had something that would look grand mal, like a tonic-clonic
Mm,
seizure, but I have had a lot of like things that could definitely be focal or absent seizures.
yeah.
It's pretty hard to like, um, seizure activity can look like pretty much anything.
Yeah, I know.
It can look
I
like
was
just
just,
doing this, or it can look
yeah,
like,
yeah.
yeah.
I was just
So
wondering because, like I started having non-epileptic seizure first, but
yeah,
it was not non-epileptic seizure because you're aware it was dystonic
right.
storm. So like those terms can kind of like interchangeable, and it's really
Yeah.
tricky to think about. Um, I do want to dive a little bit more into like the biggest obstacle right now you are encountering during like this kind of diagnostic process, because I know was especially like neurologist
Yeah.
increasingly diagnosing people with FND, with
Yeah.
psychogenic, somatic,
Yeah.
all that kind of thing. Yeah.
Yeah. That has to stop.
If those are your experience with a lot of providers,
Yeah.
did you have prior things that going on that make this even harder for you to get like physical
Hmm.
issues to checked up?
Yeah, there were a lot of things like that. The biggest factor that made it very difficult to address what has kind of been the most troubling issue, which is like the autonomic issues, like fainting all the time or like losing vision or being close to fainting, and all of that. Like it made it difficult to address those. The fact that I had an eating disorder,
Mm,
and I'll put that in quotes because like it is a loaded subject. Like I have gone back and forth even in the last like month about the story that I believe myself about what happened with me and like why I ended up in the system for eating disorders, because I believed that I truly had an eating disorder up until like a month ago or 2 months ago maybe. I
oh,
believed that during that time, not that I still do, but that during that time, like what I was displaying was actually an eating disorder in part. I never believed it started that way, and even when I didn't have an explanation for why, like I remember in treatment centers and everything, when they'd ask me how it started, it was that I had GI issues. Like I was having a lot of these, upper and lower issues. And then I lost some weight. People took notice in a positive way and then kind of went from there. So that was always the story, right? And that's a really common story. Like that story isn't like, it's definitely not unique among the eating disorder population. A lot of
mm,
people's started with something that like made it easier to not eat, or like they got sick, even if they just got the flu or something.
yeah.
So, because that was there, um, that was, I started seeking treat or getting treatment for that when I was maybe 14 or 15. And then um, that followed me, like to college. It was very difficult to kind of get over, in the sense, I think part of it is because food always was like making me ill. So it wasn't just like the whole process of not liking food or having issues with it started so young. Like as a child, I had issues like staying at the table too long and finishing my food, very picky and like didn't, um, yeah, just all those issues started really young. So that was like the biggest thing that made it hard to get diagnosed. I didn't have a diagnosis of FND. Um, although I figured that I feel that if I went and sought out a diagnosis for like, I think if I went to neuro more, they would give me one. I was diagnosed with a or a sleep disorder. Um,
Mm,
back in like, I think I was diagnosed in 2013, but the biggest issues I had with it were in 2017 when I like
mm,
crashed my car a bunch of times because um I kept like falling asleep driving. I think I was just fainting now, but yeah. Like again, and all these things, like trying to look at it through like a new lens. And with like the eating
yeah.
disorder, it's like, I think that when your body is getting sick from something, it is natural for it to like reject it and like have it start to have psychological issues with it. Like I don't think it was, the reason I question it is because like although the thin ideal became part of it, I think that a lot of people wanted to be thin, during that time period,
Mhm.
and that's why I think the rhetoric around like, oh, what's your secret? Like, holding people who are sick up like gods in that community, obviously problematic, but I think it's more percentage of that community than we would think that have underlying medical issues. So I think that's
Yeah.
another place to hide.
I actually think it's so interesting when you said that, like, it's actually for the psychological mind to somehow protect ourselves and then to start
Yeah.
and really become a little strange. And then I think that happened to me as well because I can totally understand, like, with an eating disorder background and then having
Yeah.
misdiagnosis with like bipolar and stuff. And
Mhm.
you kind of feed into that cycle of trying to find things to fit into that picture, right? Life
Yeah.
events, what they say often.
Oh, yes, right. Like you mean when they're, yeah, like they retrofit the patient's story to fit the diagnoses.
Hmm.
Yeah. Yeah, like bipolar disorder really keeps following me around as that one is funny because I never was even officially diagnosed with that one. It's that was ended up on my record based on an assumption because of a medication that I was on that's typically prescribed for bipolar disorder. Someone made an assumption and then it became a game of telephone, and it was like too small. Like the issue was so much, it became so large. Like it was like when you're in the hospital for so long, you have so many issues, it's like you kind of have to pick your battles, and I just like gave up on that one, even
Mm.
though there's like bolded writing in several of my records that like patient does not have bipolar disorder, has never had, like does not meet the criteria, like because these some of the rehab psychologists have really tried to like rally for me, and I'm really grateful for that, but like sometimes there's just no getting through to the people who aren't going to like read your record thoroughly.
Yeah.
um you never know where they are either.
That's really true. Like it was like only the last 2 years I started reading all my notes and
Oh
realized
gosh,
there's
yeah.
so much issues underneath.
Mm.
Like,
My dad's in his 70s and it still doesn't read his notes. Like he was here recently and I had to be like, Dad. He's like, oh, so you think I should be reading my records? Like, yes. What? To be fair, my
yeah.
dad's white, so I think he maybe enjoys a little bit of privilege that he because my mom's been sending me my grandma's records and her records to review for like a few years. Because because it's even when I was in vet school, like there was like I had to communicate to my mom that that her mom was in congestive heart failure, and she had been for months and had been on heart failure medications for months. But this was around the time when like my mom started always sending me like all records. But yeah, like I looked at her med list when my mom sent me a record to look at, and I saw that there were heart failure meds. And then, you know, I asked my mom like how long she'd been in heart failure. My mom did not know she was in heart failure, and then I had to call the nurse and have a conversation about patient communication.
It's great that they start, yeah, following with the notes. So many things they can say, and they always say it doesn't really matter. It's just the plan and assessment, right? But no,
Mm-hmm.
they always took the copy and paste like with the other summaries, whatever.
Yep.
Like it's proven the
Yep.
easiest way to diagnose. I hate to say this, like, I think for particular this podcast, I think I really have to address one thing that often in every single episode is that
Mm-hmm.
we do not really say that eating disorder, FND, psychological issues doesn't exist. Like
Right.
the diagnosis is real and people really are suffering and they all have uh some degree of psychological disabilities, but the problem is that with physical issues that is so prominent for us, right? um
Right.
and often we're being put in the box because it's too complex. And
Yeah. I mean, I know that for me, like I just wanted something to make sense. Like I just wanted to understand. I want something to make sense so that I could like fix these issues, like I didn't care if it was a psychological issue. Like, I had no problem with that. In fact, I sought treatment for my eating disorder before telling my parents that I thought I had an eating disorder. Like that's a very not typical thing to do. I've learned, from the many
mm,
therapists and nutritionists and psychiatrists I've had over the years. And I think that there's a few things like that can really help parse out when someone has an underlying physical condition and when they are truly like, or maybe more likely to be purely suffering from a psychological condition. Like there's a similar principle in veterinary medicine where it's like, I like to use the example of like when your cat or your dog is like peeing inside. Um,
mm,
we always like, owners often want to blame it on behavior. And like, we always do a medical workup first. Like you have to, it's really not okay to not do that. And I don't know any veterinarian who wouldn't. You have to fully exclude that. And then if something recurs later, you have to do another medical workup. You can't, even if they already have a known behavior issue, if something changes, you
mm,
have to do another workup.
yeah.
Like it's just medicine. So, like what these do when they put something in the psych category is it makes it so that they can like, they have a legally kind of, um, they have a way to get out of any liability should anything happen to you from a physical issue that could have also been caused by the psychological issue that they knew about. You know what I
Mm,
mean? Like they would be off the hook if some, more most likely the way that doctors in large institutions are like defended. Um,
mhm.
it's likely that they would, be off the hook for something like that if there was something on the record that made them think, it was just this or just that. Then like they're, not going to have any fallout, which is frustrating. But
Yeah.
yeah.
I've heard a lot of stories, like scary stories of someone actually passed away recently or didn't even
Hmm.
make the headline, but
Right.
then they often like, died because of physical issues, but labeled as like, oh, anxiety.
Hmm.
Like
Yep.
anxiety can kill them.
Right. I think that we're really not, I don't think we understand the mortality rate of these types of conditions for a similar reason to not understanding the mortality rate accurately for eating disorders, which is the fact that like there's a lot of different reasons you can pass away from these things, and the way that we like chart death is
Yeah.
kind of like based on the thing that like the last thing. And it's like, so you wouldn't ever put Ehlers-Danlos syndrome or dysautonomia. It would be cardiac arrest. It would be, liver failure. It would be kidney failure. It would be, something like that, like, or sepsis. It wouldn't, even though all of those could have been EDS patients, and it could have been, that was the primary cause of those last events to cause the mortality. But
Hmm.
like that was a problem with eating disorders because it really skewed the results. I remember like a big issue I used to talk about with like eating disorders was like that they thought anorexia had a higher mortality rate than bulimia. And I know there's like
Yeah.
way more categories now, but the skew was basically because when people die from anorexia, it was usually from more like an atrophying of the heart than
Yeah.
when people would die from a electrolyte shift that would cause an arrhythmia that would be sudden. And when you die, like you can't detect that anymore after death because
Yeah.
your electrolytes kind of equilibrate. It has to do with like shifts across the cell membrane, and they kind of all come to a equilibrium within a couple minutes after you pass away. So you wouldn't,
Yeah.
yeah,
Not detected.
right,
It's like the same as like someone have a stroke. And
right,
often, like with CCI, there's a lot of
yep,
possibility of like a brainstem stroke, but
yeah,
you can detect it. You can see because even at the worst stage of mine before surgery, the ER physician was just like, "No, like you do a CT, it's not going to show anything." That's scary because they
hmm,
know it.
yep, right, right. And that's another big issue that I've encountered recently.
Hmm.
Like, I don't like to face these ugly truths about humanity because I'm someone who really doesn't like, I give people the benefit of the doubt to a fault. So, and I always think people are trying their best. Yet,
Hmm.
um, unfortunately, like there are a lot of tests that physicians have at their disposal that they don't use, um, not because insurance wouldn't cover it, and not because like whatever. It's because they don't want to know. Like it's almost become a situation where I feel like they're less likely to do the test for certain conditions, like dry eye, for example, is one of them that I'll use here because it's really convenient. Um, for example, like they don't want to, like a regular ophthalmologist won't do what's called a Schirmer tear test, where they put a little piece of paper in your eye. It's a very cheap test. We do it on dogs. Um,
Hmm.
and it measures the tear film based on the movement of a dye through a paper
Yeah.
that is absorbent. So really cheap test, really dirty, like easy test. And there's some very agreed upon numbers that like if you don't produce that much tear film, that's diagnostic for dry eye. Now, there's other ways of evaluating the tear film, but not in such a numeric way that is like
Hmm.
undeniable. Like the other methods, you could more easily say you missed it, right? Whereas with this, you're looking for it. If you found it, you now have to report it. You know what I mean? So the issue here
Oh.
is that because I got really angry that like they did this test on me that I've done on hundreds of dogs, mind you, by myself with them moving, but we'll just move past that. They didn't do that at the regular ophthalmologist, and I had to see a subspecialist, and then she did it. And I'm like, so why? Because I was like, my score was very low on those. Like I clearly had dry eye, and I was like, why wouldn't they do this? Like I was very mad.
Hmm.
And she was like, frankly, because like they don't want to know the answer, because dry eye is a condition that's not often covered under insurance, and they don't want to deal with that, and so they'd rather not know. And it's terrible, but unfortunately, that happens in every field in human medicine, and it's
Yeah.
really, really despicable behavior.
Agree. Because I feel like
It's criminal. It's
this
criminal
is
behavior. People die because
this
of it.
yeah, this is why I feel like it's definitely terrible with my test showing positive, but then not just because they don't want to do the test. Even sometimes
Hmm.
they do the test, they don't see you, and they said, oh,
Yeah.
the physician did not interpret it, so this test is
Right.
just there wasted.
Yep.
But I mean,
Just,
you can of course collected it and talk about, malpractice or whatever like that.
yeah.
But I mean, patient already so busy and so sick, and
Yep.
we don't have another additional
They
like
prey on that.
time. Yeah.
I feel like they prey on that they're counting on that. That's why these systems continue, Amy. It sucks. It's very, very upsetting for me to have to think to realize these things, but the only thing more upsetting than realizing them is realizing
Mhm.
that most people who interact with the healthcare system don't realize them either. Because like I only have this perspective because I managed to scrape through my medical, program before my symptoms got so bad that like, I was hitting a wall. And some might say I did hit the wall, in vet school and I pushed through it because, I endured a lot of admissions and procedures and stuff to get through my clinical year. Um,
Mm.
and like countless ER trips. So but like now I can say that like I have medical training, and I do understand these processes much like easier than
Mm.
like there's some things I can just call BS on immediately. And that's really nice to be able to do. I don't have to look it up for a lot of things. I can just be like, what are you talking about? And I trust myself now because I've
Yeah.
been right like several times, not only with myself, but with like friends of mine who ask me for advice, with family members.
Hmm.
Several things for like my grandma that like they were going to try to like once they started running decisions by me. I'm not going to be like she got better, like she has Alzheimer's, but I do think that her care is being managed a little more appropriately. I think that people, I used to think, oh, let the doctors do their job. They're going to do their best. I don't want to interfere by either withholding information or by like inserting my own ideas and like overwhelming them with whatever. Like, no. So what it is that like the people who are going to do the best job of making sure you're okay is the people who have a skin in the game. You know,
Hmm.
doctors don't have skin in the game for you. Like they want to go home. You always have to
Yeah.
think about people's end game in this interaction, right? And it's hard for me to think about because I don't know, like I think there's like there's a disconnect because like I chose my line of work because I love doing it and it's something that I would do. you know
Mm.
I would do it for free. I mean, I started out in the animal field as a shelter worker for like $8 an hour, like minimum wage. And it's something that I basically did do I did actually. I started out volunteering really in high school. Um, it's hard for me to believe that people go to work um, in a similar field to me where their patients are, their same species and like they don't,
Mm.
want to be, their goal isn't to like help this patient that's in front of them, but they're thinking about like, how do I get home soonest, and if that means rationalizing a way to not run this test that would require me to do more paperwork afterwards, then that's what they're going to do, 9 times out of 10, unless they're that one person who, you know, we've met and have got us somewhere, you and me, like you meet them here and there, but like it's the exception, unfortunately. And
Hmm.
I thought it was the rule.
Yeah, I can see that. I mean, I definitely feel like that's what most of the doctor nowadays, like when they say some things that irresponsibly, is they
Yeah.
just kind of try to get through the day and get through the patients and they're done.
Yeah.
They have family.
Right.
And then, I mean, like you said, we're exactly right. Like they're human still. But even they're human, they should have empathy, and especially in that medical field. Don't you agree?
Yeah, I do think that they need to be held to a higher standard, given the power they have. Not only like they hold power because um I don't know, I'm trying to differentiate it from like the police force a little bit, like put it another level up because like they hold power as well. Yet people kind of know what they're getting into with the police, at least people that look like me.
Hmm.
Like we know to be on guard, you know. I don't Most people don't go to the doctor on guard unless you're like us, and that's because you've been abused for years. Usually, even one experience wasn't enough for me. 10 experiences weren't enough for me. Like I got cancer because of people making errors and not telling me about results and, minimizing issues. And that still wasn't enough to make me just go into it expecting to not be
Hmm.
dealt with. Like I still kind of kept that like positive outlook and kept thinking, oh, well, that's a weird exception. That's a weird situation. That was weird. That was weird, you know, time
Mm-hmm.
after time over the years. And then um, I think it's come from like getting to know physicians myself that I've worked with, like as a patient, and then also having people in my life that are my friends that have become physicians and are able to kind of be like, whoa, you know, this is what's really
Yeah.
happening over here. I mean, they like, I have a friend who's just starting out in her first year of her residency in PM&R right now. And, um, you know, even like it's been shocking for her to hear what her colleagues talk about related to patients, and like, you know, not wanting to care for them, acting like they're, you know, giving them extra work, or like, you know, complaining about the, you know, whatever it may be. And it's like, you know, these people don't want to be here, right? Like, you know, that they,
Yeah.
like that these are some, this is someone's mom, this is someone's, you know, like I think people don't realize until it's close to them. And like it's really odd to me that so many people in medicine are able to have that perspective.
Especially the next generation, like, the
Yeah.
resident eventually become attendings. And so it's
Yeah.
a scary thing that to know how the mentality is in that health system and all these
Yeah.
workers. I mean, we try to blame the system, but essentially like the people still there's issues with that whole entire like societal
Yeah.
culture.
Yes. It comes from, I think there's a few industries that capitalism and like it doesn't have a place, and medicine is one of those, because there's certain industries, like art is another one, where like when you put money in it, when you create that monetary incentive, it defeats the bottom line, you know, with art, obviously reasons because being that art is supposed to be a creative expression. When you're introducing, you know, like a formulaic kind of money making way of creating what you think these people are going to want, you get Taylor Swift, and it makes a lot of money, right? But is it amazing art? Is it new art? No, absolutely not. It's a formula. All the songs are the same. But when you do that to medicine, what you have is like, I mean, actually, it's kind of funny how like accurate the art thing is, because if it's gonna be something classic like a coronary, you know, you're probably fine. You're fine. But if it's rare, like if it's something new or under, like something you don't know a lot about,
Mhm.
um, it's not going to catch the attention, right? They're just going to move
Yeah.
on to the next thing, get you off their desk, just like in one of her songs, right? Get it off my
Yeah.
desk.
Well,
Um,
I can see that, especially like, the way that I experienced this exactly same thing as well. And realizing that things that it didn't really show on test or imaging, and they don't really do the second time, the third time, they feel like, oh, we already
yeah,
did it. It's negative.
correct. And if you ask, like they will try to talk you out of it. And like that was a stage I got stuck into. It's so frustrating because it's hard to even, it's not like I didn't have guidance from people, some people who had been through the medical system in some amount. My aunt has chronic illness, and has navigated the medical system since she was a little girl in the 60s, as a Black little girl in the 60s. So,
Mhm.
you know, it's difficult to hear from people who've had this extensive experience and not think that they're just like jaded, and that they've had a difficult experience for this reason or whatever that reason, or this set of reasons that don't apply to you, isn't that you, don't apply to you, right? Like I always thought, oh well, medicine's better now, like we're not in the 60s anymore, and you know, we have all these new modalities, we have like, you know, I thought it was fundamentally a different landscape now,
Yeah.
and that, you know, my issues wouldn't be minimized as much. But I think that's the key, is like we don't know what we don't know. And so like we don't really know the next thing that will become like, that will pull off like pull down the veil on, you know. I didn't
Mhm.
know I was living with a disease my whole life. Like I knew that I felt terrible and that no one could ever explain these things. But I bought into the fact that I was crazy. Like I thought that I was psychologically, and I shouldn't use that term even, but I fully bought into the fact that like every symptom I had was a manifestation of like a psychological issue. So
What's their
it's
explanation of it?
what was there. So okay, yeah, for most of my childhood and actually, like my entire life until I think until I was diagnosed with EDS, I thought that like my vasovagal syncopes and like presyncope and like all those were panic attacks, right? And that is like it can be something that occurs with panic attacks, right? So it's like difficult for all these things because a lot of it has to do with quantity rather than quality for, like when I would ask my dad, how come I can't see when I stand up? Does that ever happen to you? Because I asked him this several times growing up because he did say that it had happened to him before, like that it used to happen to him sometimes in high school when my dad grew up on a dairy farm in northern Wisconsin in the 50s. So he like went to a one-room schoolhouse, like it was very remote. Um, it wasn't like you'd go to the doctor for something like this. But he said it used
Yeah.
to happen to him when he would like not drink enough, like when he'd be out doing farm tours and then like lay down and then stand up again,
Mm-hmm.
and I think some other people would say throughout my life who would see this happen to me or who I'd mentioned it to would say that it's happened to them when they're hungover or they drink too much or when they're really sick with the flu, really dehydrated, stuff like that. So I think that throughout my life, hearing people say that happens sometimes, like if you have a seizure, people aren't going to be like, oh yeah, that happens to me all the time, like
Yeah.
there's certain things that like it finally crosses a threshold at some point where people, or you say the right thing or whatever. One thing doctors got hung up on for me a lot was like when my hands and feet would swell when I'd be out in the heat, especially it would happen a lot when we were hiking or going for long walks.
Mm-hmm.
I would have
Yeah.
swelling in my hands and feet that like persisted for 48 hours sometimes, like so much that I couldn't bend my fingers all the way. I could like bend them only a little bit, so like really
Mm-hmm.
swollen. And I do remember doctors like getting, like they didn't want to dismiss that, but they still didn't, obviously they didn't explain it, but it was like I remember them being like, oh really, like if the swelling doesn't go down. But I feel like because I was never there when it happened, actually, now that I think about it, it did happen times when I was there, but they were like, well, I'm sure it'll go down, like it's funny how even when you do have symptoms that are like in their face, they're like, well, I sorry, sucks to be you, but I have to go move on to the next patient.
Yeah. Yeah, and
uh
then you have a lot of more symptoms than other like regular patients. So like you
yeah,
just mentioned a few, and then it's still like not the whole picture.
right. It's like and it's this game I feel like throughout my life of, what am I going to mention, right, at this appointment? What am I going to mention? Which ones are, it's like a mixture of mentioning which ones are the most troubling versus which ones are the ones that I think might catch their attention, or which ones are new that I haven't mentioned yet that maybe this set of issues might catch their attention. They might have a test they can run that might like even before I knew I had an illness, I knew that I had issues that were not explained. um
Yeah. Yeah,
and after all
there's
the psych treatment, yeah, it's like i
go ahead.
i, I always kind of still believed that it was that, but I thought I wasn't doing enough, or like I hadn't done the right type of therapy, or you know what I mean, like I still thought that for quite a long time.
Um, yeah, I think mental health is one thing that I'm not saying that everyone um might have a physical issue than the mental issue, but it's really
Hmm.
mixed together. It's hard to tell.
Yeah.
And if your I think maybe it's the perception of it. If you receive the idea of that's a mental health first, like
Yeah.
for example, anxiety, right? And it's
Yeah.
hard to become like, oh, that's actually not my anxiety. That's just my palpitation.
Yes. Correct. It took like I was in vet school, and it was after I'd been diagnosed with EDS when I started realizing that like POTS was, and I'm saying POTS as like a gross oversimplification of the autonomic issues that I face, because there's too many. Like I have four of the types.
Different types.
Yeah.
As like when you sit up, is it quickly your
Hmm.
blood pressure is dropping, or is that
Yeah, that
the
was the
heart
first
rate and
one.
blood
I had
dropping?
orthostatic hypotension. Yeah. It's so the naming, oh yeah, I think I was going to say that just I was in vet school after EDS diagnosis when people started mentioning it more, POTS. And I think that's because long COVID was happening and people were like waking up with POTS like anew as an adult, and realizing
Hmm.
this is not normal. That's a big distinction that has been important for me in kind of, because there's some other groups I'm in with like long COVID and EDS people. And it's like, on the one hand, it's challenging that there's so many more patients in a system that was already like small, but
Yeah.
at the same time, it's pushing funding and it's pushing awareness, because You can't tell someone who's like a full adult who wakes up with new symptoms that they're not real as easily as you can someone who grew up with them and has never known another life without it.
Yeah,
But
even that, I remember that was 2020 that when I went to
yeah.
hospital so much, like I literally hear nurse was saying how, oh, like they always now have POTS, like somehow
Hmm.
it's a fancy new name, like new
Yeah.
generation issues or something like that.
Right. No, it's yeah, it feels like a system, like a situation. Like I never got to get really like diagnosed. I mean, I had a tilt table test like last year when I was inpatient at Hopkins for a month because they had never done one for me because it didn't exist like before when I was first diagnosed. But like it was put on my record a long time ago, but I wasn't told it was a disease. Like I was told as a teen and everything that it was like a common thing in that it was more common to find in older people, orthostatic hypotension specifically. And then, because
Yeah.
that was the first one after the vasovagal syncope, that's more of like an observational. But the yeah, I was told it was common in older people and that it sometimes happened in young women as well, but it was nothing to worry about. It wouldn't limit me. It was not a disease, that it was just like a common variant of normal, something that I'm familiar with now in medicine. Like there are a lot of common variants of normal for different like situations that like I don't know, like hypermobility, for example, how like hypermobility doesn't necessarily come with all these other things. It can be something that doesn't cause great issue,
Yeah.
but
So
yeah,
of course there
fainting
is.
does though cause issues.
That's true. Well, it's a lot of like, that's why it's a spectrum, right? And then, you have
Yes.
the lighter side of just hypermobility and, benign hypermobility and the HSD. And then you have
Yeah.
the Ehlers-Danlos Syndrome, which really
Yeah.
involves seeing all the soft tissues. And yeah, so did you actually get a lot of issues with like, diagnosing the, I know that you have some neck issues.
Oh
Like,
yeah, like I've been recently having issues with that. Yeah. That is another, yeah, it's just it is another situation where there's like an immense amount of administrative burden on patients in a situation here where they're known to be having neurological, potentially surgical issues, and yet still it's like I have to do all this administrative kind of like calling and sending things and trying to get them to write the right order for the right imaging, and then trying to figure out if insurance will cover this or that provider, to even go see someone who will believe in the condition. Largely the guy that you went to is who I looking into. There's other neurosurgeons around that my tolerance for being gaslit is just low. That's all. Like, so I'm just, uh, I would very, very, very much rather go to someone who like already believes in these issues so that I don't have to have that fight. It's really hard for me to have that. And I like legitimately worry about having a stroke because of the stress of either, going to the ER or because of being gaslit in an appointment. Like my blood pressure gets so crazy. And I just feel, um, like, yeah, it's not great. I don't want that.
yeah, I saw that. It's really scary. And I mean, a lot of people don't really know like what exactly CCI can cause
Hmm.
because literally that's the very first of suboccipital and your first of C1 instability. And
Yeah.
the it's the severity it can get, it's like it's called decapitation.
Yeah. Like cervical
Yeah.
dislocation is still, a form of euthanasia that's like considered appropriate for certain wildlife species. So it's the first area in which I really delved into learning about the brainstem was because I used to work as a euthanasia technician in my first shelter job. I went for training with the Humane Society University and got my euthanasia by injection certification. And a lot of that kind of theoretical backing is talking about death, like where does death happen? And it's in the brainstem, that's what it is.
Yeah.
That's what keeps you alive. So yeah, like it is a frustrating situation that like there's issues with your cervical, that there are issues that exist with our cervical spine and even the articulation with our cranium that like they either don't know how to image or are like strategically avoiding imaging so that they, you know, alleviate the liability on themselves. Like that, it is criminal because like people do pass away because of this and they usually won't know. Like people,
Yeah.
so many people, you know, have already died because of this kind of negligence and like them just not doing an adequate job of being diagnosticians.
Hmm.
And they won't know, you know, like that's kind of, that's part of what motivates me, I guess, is that all of those people to avenge.
Yeah, I agree. It's really unfortunate. I heard a lot of tragedies because of that, and it's not recognized besides PT
No.
who actually know about it and then knows this
Yeah.
person's condition, but they still get gaslighted. Like even towards the end of my diagnostic journey, that I was so
Hmm.
sick that I couldn't move, and I was still being told F&D because you know
Yep.
you have to have severed spinal cord to be like that.
Right.
And you're right, the brainstem seem to always be avoided because you
Hmm.
have brain imaging, and then it goes down to around the cranial, like above it, and
Hmm.
then you have the cervical, and they start
Yeah.
with that around their area.
Yeah.
Maybe
They don't usually
Chiari
get
will
the
be fine.
junction.
Yeah,
Yeah. No, it is interesting because Chiari is like, well, it's not called Chiari in dogs, but it's called Chiari like malformation,
yeah.
crani or yeah, cranio-occipital malformation syndrome, I think is what we call it,
Hmm.
COMS, in dogs. It's really common in King Charles Cavalier Spaniels. That's one of the reasons they're not considered humane to breed in certain, like the UK, I think, has outlawed it, as well as bulldogs. Which, you know, the reason for that, I told you guys earlier about the smush face, constant life of being unable to breathe, dyspneic all the time. So yeah, like this is something that, you know, veterinary medicine is aware of and of how to diagnose as well. And that's what's frustrating is like, because in vet med, you can do more of a tailored like MRI. Like I can just go and be like, um, you know, I want them to take like these views, like the views are called something different. And then like I want them to do, I can tell them like exactly the area of the body. Like I don't have to do just the cranium and then the cervical is fine. Like it can be, you know, from the cranium to like C5 if I want. Like I probably wouldn't do that. I would just do the whole thing. But you know, you can
Hmm.
kind of do it a la carte a little bit more because it's not
Hmm.
quite yet run by like insurance companies and diagnostic codes and algorithmic medicine the way that
Yeah.
like human medicine is now.
Mm.
So there's yeah, a little more room for tailoring it to the individual patient, which is
Yeah,
nice.
so
But
eh, that's interesting because I think it wasn't until I started to getting upright MRI and I realized that,
mhm,
the cranial junction, that has to be a separate code. And then you have to do it
mhm,
separately with the radiologist reports. But
yeah,
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 that's another really
yeah,
juicy topic with like radiologists. Like I know that you
mm,
probably read those like MRI yourself, but like
yeah,
the radiologists also get away from it by always saying that it's within normal limits.
yep, yeah. There's a lot of jargon that is uh it's almost like legal jargon where it's
Mm.
um you know, certain words are more committal than others. Like we try not to use a lot of absolutes, you know, in medicine, especially in veterinary medicine, because of how much we don't know and how much we're aware of what we don't know. Like a vet would never say like that can't happen or like that there's no way that's happening or just that's not happening. You know, like you would look and then you would say these images suggest that these images suggest that it's normal, like or whatever. Like you would say, yeah, within normal limits. And a lot of the time they'll say things like within the viewed area or like with the images. There's a lot of little words, little phrases that kind of take the liability off of them should they have missed something because and in a way it makes sense like radiology is uh like it is difficult to look at in the way that you need to look at it in order to be a good diagnostician of um you know of radiograph of any types of like radiographs really just mean x-rays but of you know radiographs or like cts or mris anything like it's like you could have like four people in a room review the same set of x-rays silently and like all come up with like vastly different things. um there's this systemic approach like um that is taught but like everyone's eyes are just so different and like I don't know how much you've looked into, so like some of the like some of the things I've seen is like people from different uh cultures, like Eastern versus Western cultures, when they look at an image, will describe it differently. Like any image, just like a picture, like of maybe some people on the beach. If so, like people from Eastern cultures are more likely to describe like the overall like vibe and setting first,
Mm, yeah.
whereas people from Western cultures are going to talk about the individuals there, right?
Mm,
And like so, you apply that and it's the whole huge spectrum to people interpreting x-rays and radiographs and stuff, and it's a similar thing where it's like when you're looking at an x-ray, it's flattened, it's a 3D
yeah.
structure that's flattened, so everything's like smushed on top of each other, and you're kind of trying to like your mind like create a picture that's 3D. So it's a field with a lot of nuance.
Yeah.
I get why they have to have those kind of non-committal statements, because like it is likely to miss something, but I do think they need to be better about like allowing people to get a second opinion. And I think it's a really big red flag for physicians when they don't want you to have a second opinion.
Yeah.
They should want, like, we always want the patient to have the right diagnosis. Like in vet med, I don't know very many vets who are like, no, don't go to them, or like don't get a second opinion. It's like, no, like do that, you know?
Uh, yeah. The radiologist report often, like you said, the words, like
Mm-hmm.
I saw also another really big one is unremarkable.
Mm-hmm. Oh
They can use
yes.
unremarkable for everything. Like
Uh-huh.
if you even have a previous imaging of positive some kind of findings, then you go to
Yeah.
another different place with exactly same region, for example, cervical.
Mm-hmm.
They can just say that, oh, it's just unremarkable, unremarkable all the way down. There isn't
Yeah.
stenosis, there's nothing.
Right.
And then,
Yeah. I hate that. I don't know how else to say it, but like even in vet school, when I went through different exam templates for myself and what I would use for my records, I really disliked using the ones where you just write normal, because it feels like, or like unremarkable, whatever it is for the different body systems. Because it's
yeah.
like, it's very like I'm not giving very much information, What does that mean? Right? Normal for this breed, normal for all dogs, normal for, you know what I mean? Like it's
Yeah, yeah, yeah.
very chat. Like sometimes I would say like if I described something that was abnormal for dogs, but was like a congenital known like thing for this, for like for example, sheepdogs have like a bunch of weird dew claws, like they have all these extra toes, or like
Mm,
cats, like Hemingway cats that are polydactyl. It's like if I said unremarkable, right, and didn't comment on the polydactyly because maybe earlier I mentioned it was a Hemingway cat or something like that, um that's wrong. Or like, I mean, that would not be certain. I don't know if I did that mistake, but I've certainly seen classmates get their like have to review their records because during clinics like they didn't comment on like a problem that isn't abnormal for that animal, but that is technically abnormal, like for cats or for dogs. Like you should comment on it, even if it's not causing a problem, because it's for the next doctor. Like that's what you're writing
yeah.
your records for. It's so that it's like with a recipe, it's so that someone could make the same product based on
Mhm.
what you've written there. Like so someone can bring up an image
Exactly.
pretty accurately of like what you saw that day.
Yeah. I mean, that's what kind of like a neurologist right now is doing, is you go to
Mm-hmm.
neurosurgeon for exactly the second opinion of your
Mm-hmm.
imaging. But the neurologist said, oh, I just checked like all the imaging is normal. Most of the time they looked at the report and not really
Right.
the imaging.
Yes. That's a huge issue. You're right. Like um there's way too much of the game of telephone being played in medicine. Like I can't like emphasize it enough. It's like what you were saying about them copy and pasting like all these like things into new form, and it's like you have to do some of that. So like you do. It's about not stopping there,
Yeah.
just like with when you find like something abnormal with someone, but it maybe doesn't explain everything. You don't stop there and just
Mhm.
say maybe those other things will go away. Unless there's a treatment that's like treating the root cause, then maybe you could say that, right? But
And someone
frustrating.
say it's probably about like to seeing, more new patients because, like you can't just keep going on. And that's why there is doctors that persuade you not to do certain tests because they feel like
Yep.
I've done my job
Yep.
already and you still want me
Yeah.
to do more.
It does. Yeah. It's actually and it's not even just the individuals that seem to have that attitude, but it's like the whole systems that have that attitude. Um
Yeah.
it is frustrating. It's frustrating that they continually like double down behind each other, but it's reminiscent of the way that administration works at like Cornell as well, where I went to vet school, because I noticed that same kind of like very irrational supporting of the last statement that was made.
Thank you for joining us for part 1 of Dr. Hilary Merry's story on occult awareness. We have explored some eye-opening aspects of her experience with veterinary care and her personal health challenges and complexity of navigating these rare disorders. So stay tuned for part 2, where we will dive deeper into Dr. Mary's ongoing journey, that we also are going to discuss the broader implication of her story for both patients and medical professionals. Don't forget to subscribe to Occult Awareness on your favorite podcast platform. Share this episode with friends and family and leave us a review. Your feedback helps us reach more listeners and continue sharing these important stories. Follow us also on social media to stay connected and informed about upcoming episodes. Remember, your story matters, and together we can bring. Thanks for listening, and until next time, keep seeking knowledge and awareness.